Hello everyone, it's Health and Family Time once again, and we are pleased to be able to bring you another informative program. Traditionally, we know October to be Breast Cancer Month, but does that mean we do not pay attention to this disease in the other 11 months of the year? Of course not. According to the United States statistics, 1 in 8 women will come in contact with this disease over her lifetime. Once upon a time, breast cancer patients were automatically given a death sentence. However, with much research and continuous public relations on this subject, we are finding more and more breast cancer survivors. Today, we'll be talking to Ms. Rona Donawa, who is the Chief Technologist for Diagnostic Imaging, and Mrs. Azuree Williams, who is the Education Officer from the Bermuda Cancer and Health Center. We welcome both of you ladies to Health and Family.
Thank you.
So I'm going to start off with you. Before we get into the technical stuff, tell us exactly what you do as a technologist.
Okay, as the Chief Technologist, I oversee the runnings for the day-to-day service of the mammography, the ultrasound, and the bone density departments at Bermuda Cancer and Health Center, and that includes biopsy services as well.
Okay. So in defining breast cancer, what are some of the important points one should know about breast cancer?
So we need to understand that breast cancers, and any cancer for that matter, arises because of genetic mutations or abnormal genes. Those genes, when they multiply, they become dangerous, and that's when we term it malignant cancer. And when you hear the word malignancy, you have to remember that that can spread to the rest of the body, and that's when it becomes concerning.
So let me bring you in, Mrs. Williams. How do we, what actually causes breast cancer? Or I know you mentioned the malignancy, but what is there something that hereditary we know it plays a big role in it? What other things cause breast cancer?
Genetics is one of the factors, but there are many risk factors,
such as
environmental factors, lifestyle, our diet, exercise, smoking, alcohol. The list can go on with the different things that put us at risk of developing any kind of cancer. And as well as specific, we're concentrating on breast cancer today. So some of those that I mentioned, risk factors, definitely are high risk factors for breast cancer.
Okay. So, I'm looking at you because I'm saying to myself, well, some people have those risk factors and yet they don't have breast cancer, but we'll get back to that. So a person has been diagnosed. What should the person do immediately, Mrs. Donawa?
Okay, so we'd recommend that they contact a family member for support reasons. That would be the person who they're going to take with them to their appointments, help listen, that second listening ear at the appointments. After that, usually they're going to be recommended to see an oncologist. The oncologist is the cancer specialist, doctor who's going to recommend treatments, help to plan the services such as radiation therapy and chemotherapy.
Okay. And so you brought up the treatments. Can we adequately treat the individual here in Bermuda?
Yes, Bermuda is very equipped for treating breast cancer on island. We're very fortunate to have a team of surgeons on island specialized in breast surgery. And we also have the team at the hospital, at King Edward Memorial Hospital, who work in the chemotherapy departments to administer chemotherapy medications. And now, as of May, we have a lovely radiation center at Bermuda Cancer and Health Center, which treat patients with radiation. And those treatments can last sometimes from 6 to 8 weeks. So we're really saving the public that added time overseas for treatment, and financially is a big savings to our insurance.
Okay. So does that mean one would no longer go overseas for any type of treatment?
Well, they can. It's really, the choice is up to the patient. However, it's more convenient to stay in Bermuda because you are surrounded by your family and loved ones. You can go back to work, especially when it comes to radiation. The actual procedure, it's only a few minutes, and you're in and out in max 20 to 30 minutes, and you can go right back to work, back to business, on with your normal day-to-day routine. Insurance locally is now covering the procedure, radiation therapy here in Bermuda. Anyone locally who is diagnosed and recommended by their oncologist to receive radiation therapy here in Bermuda, we actually have an equal access fund, and the equal access fund means that we don't refuse anyone. Anyone who needs services that we offer, whether it's radiation therapy, ultrasound, biopsies, or mammogram, bone density, we offer that at our center, and they are able, if they're underinsured or have no insurance, they can come in and we will not turn them away.
And that's at Bermuda Health and Cancer.
Bermuda Cancer and Health Center,
Okay.
yes.
And so you brought up biopsy. Let's talk about a mammogram and a biopsy. Let's just define those terms, and then we'll move on. I'm coming to you.
All right, so a mammogram is basically an x-ray of the breast. We use a specialized mammography exam machine, which compresses the breast tissue in a gentle way, not often as harsh as some might state that it is. And we're also fortunate enough now to have tomography services soon to be available to Bermuda, and that adds an extra imaging quality to the exam by taking specialized images of the breast. Outside of that, if a patient were to be recommended for a biopsy is actually the process where we take a sample of the breast tissue to determine if, in fact, there is a cancer or other makeup of that tissue. So that tissue is then sent to the hospital for analysis.
Locally?
Locally,
Okay.
that's correct. So it needs to be looked at by a pathologist, and that takes usually about 3 to 5, sometimes up to 10 days. It just depends on the demand at the hospital at the time.
Okay. I wanted to talk about the different ethnicities and the impact of breast cancer on them. Is there any one ethnicity that is more prone to have breast cancer, such as black women or white women, or how does that go?
At one time, it was thought that white women actually would have a higher incidence of breast cancer. But right now, what we're finding is that black women and white women both are about on par. So we're finding the numbers are pretty much the same. But when we compare the white and black women to other races and other ethnic groups, such as the Pacific Islanders or the Asians, we'll find that we do surpass them. And what we're believing, as studies go on and there's more research, is that it might just be down to cultural differences rather than race. So it might be their lifestyles.
Yes.
Earlier, Azuree mentioned lifestyles like obesity, smoking, excessive drinking, the use of birth control pills, menopausal states. It's a long list of things, probably too much to get into on today's interview, but certainly we're finding that it might just be down to the cultural differences rather than the actual race itself.
As well as the access to optimal care. So according to American Cancer Society, when it comes to ethnicity, black women have a lower survival rate. So their cancer, specifically breast, as we're discussing today, they tend to catch it late because they're not necessarily going for those regular checkups or going for those mammography exams,
So can we say that breast cancer is inherited? Is that a definitive? I can go to you with that.
Well, in some cases it is, because it could be a genetic factor that's been passed down. So in that case, it would be a hereditary link. But in about 27% of the cases, that's not the case. It turns out to be an environmental or a lifestyle factor that's indicating that a breast cancer has arisen.
So how old should one be to start the screening process for breast cancer?
So generally, screening starts at 40. Anywhere between 40 and 45 are the recommendations. Our center follows the American College of Radiography guidelines, and those indicate that we should start at 40 and have them annually. So every year, around the same time, a patient would come in for her annual mammogram with no incidents or no problems. So she's just self-referring herself, or her doctor can refer her, but she comes in problem-free at that point to have a check. So it's a preventative measure.
At age 40?
At age 40.
And then is it yearly or by?
So annually, up until the patient can basically tolerate the exam. We have no official cutoff time for this exam at this time.
Let me come to you again. Let's talk about the self-exam, because that usually is what's recommended initially, yes?
The self-exam.
When you're checking your breast to make sure.
There's been some controversy about the self-exam, the breast self-exam, also known as the BSE. What we're finding is that we want to encourage patients to be familiar with their breast rather than actually trying to do an examination on themselves. The breast tissue itself tends to be quite lumpy, and we're finding that sometimes when patients are trying to do the breast self-exam, they are a little bit more aware maybe than they need to be. It sounds a little bit odd, I'm sure, but we just want patients to be aware and familiar with what their norms are rather than trying to assess themselves. So you might be experienced enough to know that you've got a little nodule or a little lump that you can feel, but you always feel that lump. So that's not a problem.
Right.
It's a new lump that you might feel that might be the problem.
Right.
Yeah.
Right. And so I wanted to talk about the contraceptives. I think you mentioned that could also have an impact on how much of an impact? Is it like very serious, or is it?
Yeah, and again, I think it's just in combination, and again, because none of us are the same, we're all quite different, and that's what makes it so hard to pinpoint treatments and what the factors are for leading to breast cancer. But we know that long-term use of birth control, because of the hormonal impact, can alter your hormonal levels, and they do think that some breast cancers are influenced by hormones.
Right. That was actually my next question.
Yeah.
So go ahead.
Well, no, I was just going to add, because of the estrogen levels, and when we're looking at the studies that have been carried out, that there is a significant impact on women who have used birth control over a long period of time, that it does put them at higher risk. Studies have found that women who do tend to use birth control over an extended period, they are putting themselves at higher risk for being diagnosed with breast cancer.
Yes, and also hormone replacement therapies.
Right.
Yeah, neither of those I think were intended to be used for 10 plus years, but we have a great portion of our populations here and elsewhere in the world that are on those treatments for long periods of time. So we think it's enough that it's interfering with your normal cycles and your normal hormonal levels, and that's what might be an indicator for breast cancer.
All right, we're about to actually come to a break, but just wanted to ask you one more question about any injuries. Could that possibly cause breast cancer, or is that just a misnomer?
I would have to say no. I think anybody who's had an injury, unfortunately, there could have been a coincidence that around the same time they were diagnosed with a breast cancer.
All right.
But
Any
there's no
final
link.
words?
Not necessarily. I would say that I do encourage patients to have their annual breast exams. It's just a few minutes. It takes about 10 minutes for the exam from start to finish, and it's definitely a worthwhile venture.
All right. Thank you, Ms. Donawa. All right. We want to thank Mrs. Donawa for sharing such vital information on this topic. We're going to be taking a brief break, and when we come back, our educational officer, Mrs. Williams, will be here along with a breast cancer survivor, Mrs. Gloria Dill. Stay tuned.
For you.
Move more, Bermuda.
Welcome back. If you're just joining us, our topic today is learning about breast cancer. Breast cancer survivor Gloria Dill is with us, along with Mrs. Williams. Welcome, both of you, once again
Thank
to
you.
Health and Family. So I'm going to start off with you.
Okay.
When did you first discover take us through the process of when you realized you actually had breast cancer.
Well, when I realized it, I was actually on vacation, and I noticed that there was a lump on my breast that didn't feel normal. It felt strange. It wasn't there before. So I still went along with my vacation, and then when I came back, I contacted my GP for a physical. I told him why I wanted one, and at first he was hesitant because he said, "Oh, you're so young. You probably just got lumpy breasts."
Do you mind disclosing your age?
I was 33 at the time,
Okay.
and but I went in for the appointment, and he did an examination, and he felt what I felt, and he said, "It's a possibility, but let's check it out because it's probably benign, meaning not cancerous," and we took it from there.
So, Ms. Dill, what stage were you actually diagnosed at?
I was actually diagnosed at stage 2.
Okay. And so, Mrs. Williams, could you talk to us about the stages and what they represent?
Well, the stages go from 1 all the way up to 4, 1 being less serious than any of them, but when you reach up to stage 4, that's when it's most severe. Survival chances are very slim, so you want to really exercise and go through the procedure of early detection.
Right.
Like you were saying earlier, off camera, we were talking about that's one of the major reasons why we want to promote Breast Cancer Awareness Month, is because early detection and prevention are key. And although we say age 40 is the norm for your annual checkups, this is what American College of Radiology advises, and those are the standards that we also comply with. We also look at genetic factors, which you mentioned and asked us earlier. So if one has the breast cancer gene, they should be getting tested earlier or screened earlier than 40. And we used to have our genetics clinic. We currently don't have that running right now, but people can make appointments for overseas to get that genetic testing done if they know they have a family history. That way, the early detection will be key for prevention, so they won't get to stage 4 when it may be too late.
Okay. So, Ms. Dill, is there a family history of breast cancer in you?
No family history. No. I was the only one and still am the only one in my family.
What was the impact upon your family when you told them?
They were surprised, shocked. They were like, "Well, you're so young.
You're slim."
I wasn't obese. I didn't have a lifestyle of smoking or drinking. I ate healthy, relatively healthy. I had 1 pregnancy. My son was about 4. So it was a shock. It was a shock.
Talk to us emotionally about how you handled it. Like, what did you say to yourself to get through this? You mentioned you have a 4-year-old son.
At the time, yeah, I said, if anything, I'm going to live to see him grow. Right. That was my motivation. Initially, upon discovering it, I reached out to a couple of really close girlfriends, in addition to my family, asking like, what should I do? And I was advised to get a second opinion. And that's what I did.
You did get a second
opinion? I got a second opinion.
Now, what route or how did you decide what treatment process to go with, or were you given a choice?
The treatment process was given to me by the medical professions. Okay. So when I had the second opinion, I went overseas to Boston, and they recommended, based on the information that the doctor sent them locally, and they did their own battery of tests, they came to the conclusion of the type of treatment that I would need in order to survive the process.
Was that radiation?
It was radiation and chemotherapy. All right. I was advised to have both.
Mrs. Williams, can you talk to us about radiation at this time?
Yes.
Just sort of give us an overview of what it is and how it works.
Well, there are 3 different types of radiation that are typically used when treating any type of cancer. And we have external, internal, and systemic. And currently in Bermuda, we offer external, and we use an external beam. And this particular therapy is the most common. That's what usually is used when patients have cancer and they're being referred to use radiation therapy in Bermuda. Specifically, we have that, yeah.
And so how do I know, or how would one know if the radiation therapy is working? Let me go to you first, and then you can jump on that. You knew it was working?
I knew it was working when I went for my follow-up checks.
Right.
The results, when they looked at the comparison pictures from when I first was receiving treatment, they saw a significant difference, and that showed them that the treatment that they had chosen was working.
Now you were elated.
I was.
Yes, go ahead, Ms. Williams.
So basically, the patient will be going over a period of 6 to 8 weeks for their treatments. Their oncologist, the specialist, will be monitoring them constantly, checking their readings and everything. And after their time has been completed, that's when you will really know. Once it's gone, the doctor will advise. And then even usually they give you a 5-year grace period to make sure that the cancer hasn't returned. And that's when you know it's worked. Yeah.
All righty. Did you have any side effects at all? Or?
None really. Yeah, I was expecting them because that's what I was told to expect. I had my radiation in Boston because at the time they didn't have the equipment here in Bermuda, but I was able to have my chemotherapy administered in Bermuda. So I was able to go get my treatment and go back to work. And so it didn't really interrupt my lifestyle once I returned home and had the chemotherapy here, which I was grateful for.
You're a picture of health, really. I mean, looking at you, no one would be able to say, oh, wow, you know. So you started up a support group?
Yes.
Talk to us about that.
I didn't start the group. The group, I found out about the group when I came back from treatment overseas. And the group has been in existence for a while. And it was initially it was a very private group. You know, it was almost like below the radar. You didn't hear much about it because at the time it was still a taboo to even discuss that you were diagnosed with breast cancer. So it was a very private, intimate group of women who met monthly to talk about their treatment, what they went through, how they handled it, how it impacted their family. So it was a supportive network, and it still is, because if someone new is coming in and they're not sure of what to do or how to feel or what this symptom means and what that symptom means, we encourage them, by looking at us as a positive influence that, breast cancer is no longer a death sentence. You can survive.
And so what message would you give to individuals who are frightened, I mean.
It is frightening.
It is frightening. I can just
deny
imagine.
that.
Yes, I can imagine.
It is frightening because even though the survival rate is higher, it's definitely improved, it's still something that most people are afraid of. So I would encourage any woman who has been diagnosed with breast cancer to not wait, or who discovers a lump, to not wait to get checked, because the sooner you address it, the better the outcome most times. So I would say don't delay. It is frightening, but sometimes we just have to kind of push through that and get it checked. In the meantime, reach out to family who will be your support.
Very good. So when you're in remission, I bring you in again, what changes should one make? Obviously, I'm sure diet and exercise are important. You want to just key in on that?
Key. One of the biggest things when we're looking at specifically American Cancer Society, again, because we use them as our for guidelines, and one of the key things is smoking. So if someone is a smoker, it's important to really try your hardest to quit. Smoking has contributed, especially smoking over a period of time, a long period of time. Research has shown links to that being a cause for breast cancer. we're looking at your diet. And when we say diet, it doesn't mean go on a starvation diet. Right. It just means balance, making sure that you're eating as many fruits and vegetables a day as possible, specifically 5 servings. That's the recommendation.
To stay alive. Yeah.
Yes, right. Making sure that we have organic, if we can, organic foods. If we don't have organic, making sure that we're washing our produce thoroughly to minimize the pesticide exposure, because that's also a contributor. Making sure that we eat less or avoid red meat and processed meats, less or avoid alcohol, and drinking lots of water. It's recommended that we exercise regularly during the week, at least for 1.25 to 2.5 hours weekly, either moderate to rigorous exercise. That also helps. Even yoga. Yoga.
Such positive things I'm hearing about yoga. Really.
Yes, meditation. So there are several different options that people can try to help balance themselves. It's all about balance. It's about moderation. It's about really making healthier choices so that you can prevent a reoccurrence or even prevent an occurrence. It's no guarantee, but these risk factors that we have discussed, these are things that we can change, our lifestyle, to help make a difference. Yeah.
You seem so upbeat. I'm just impressed by it. You're just like, it happened. I moved on.
I'm grateful to be here, and I try to enjoy life every moment. Okay. You can't stop what's going to happen, but you can control how you react to it.
Love it.
So,
any final words? Because we are about to finish.
Just encouraging people to make sure that it's about early detection, prevention, and education, making sure that you're aware. If people aren't sure, they can go to our website, chc.bm, and find out more information. They can call our center. They can contact Gloria Dill if they want a support group and be part of Just Between Us. So people are not alone, and don't be afraid. We're all in this together, so they can just give us a call if they need more information.
Absolutely. And if someone wants to be a part of the support group, they can
contact me directly, and they can get my information through Bermuda Cancer and Health. They will be willing to give my information, and then I can give them the details about the meetings and groups.
Could you give us a day that you meet monthly, you said?
Meet monthly, the last Monday of every month.
Okay. And
at Bermuda Cancer and Health building. We use their facilities.
All right. Thank you, ladies.
Thank you.
So much. Suffice to say, breast cancer is a topic no one should take lightly. It is imperative that we stay current with the very latest information available on this subject. As stated earlier, early detection is the key to improving one's longevity. So you know how we may have a buddy who encourages us to eat properly and to do our daily exercise? Well, why not have that same buddy encourage us to go and take the yearly mammogram examination? That's what I call a true friend. Thanks again to our guests, our team here at CITV, and of course to you, our audience. It's Health and Family with yours truly, Shay and Burgess. Thanks again.